just that passion that they exude for the profession and have for their entire life.
Greetings, everyone. Welcome to a University of Western States podcast. Located here in Portland, Oregon, and online, University of Western States offers a world-class integrated healthcare education focusing on the whole person and provides an evidence-informed approach to health and wellness. For more information about UWS, visit us at www.uws.edu. My name is Nathan Long, president of the university. Today, I am joined by the distinguished, fabulous, incredible Dr. Martha Kaeser, Dean of the College of Chiropractic. I've had the pleasure of working with, may I call you Marty?
You may, absolutely.
All right. Dr. Kaeser, also known as Marty, for the last year as I've transitioned from my previous appointment at Saybrook University in Pasadena, California. And I will say what I have said to so many of my colleagues. Marty, Dr. Kaeser, is just a joy to work with. Her passion for education, for excellence, and for keeping the student at the center of everything we do is just really inspiring to me. Dr. Kaeser, Marty, welcome to the program.
I appreciate those words, those kind words, Nathan. It's a pleasure to have you with us. And may I call you Nathan?
Yeah, absolutely.
Okay,
Please
it's
do.
a pleasure to have you at UWS. I think we are on the right track to great things.
Indeed. Well, so let's come right out of the gate. When you and I were traveling the back roads of Alberta, Canada, you gave us some insights into your background. I thought it was just so fascinating. So for our audience, could you just spend a few minutes telling us your story, how you got into the profession, what were some of your major inspirations, and any pivotal moments during your education?
Absolutely. Yes, I recall that trip through Alberta fondly. I did talk a little bit about why I got involved with chiropractic, and I grew up as my father was a chiropractor, so I grew up knowing chiropractic. That's all I knew as far as healthcare went, right? So he graduated from Palmer College of Chiropractic in 1929. So
Oh, wow.
he was one of the, if I may, old school chiropractors, right? A chiropractor who really felt that no matter what came at an individual in regards to an illness or some kind of health concern, chiropractic could take care of it. And so that's what I grew up knowing. And I really, he had his office in the basement, so I was able to, on many occasions, wander downstairs after school and visit with patients. And it was such an incredible experience to connect with these folks, similar to what my dad was doing. He was connecting with his patients, and it really made me want to do something similar in the future. He was always saying, when I pass the torch, this is going to be my daughter is going to be the next chiropractor to take care of generations to come. And so, I grew up with that love of just that patient interaction and a respect for chiropractic. So that catapulted me into wanting to become a chiropractor. Now, I did not initially. I went into pre-chiropractic in my undergraduate. I was going to pursue right away going to Palmer College of Chiropractic because that's all I knew. And well, I got into some sciences and realized, boy, this is tough stuff. It's going to be hard to be a chiropractor, right? It's a rigorous program. And so as an undergraduate, I didn't feel like I wanted to take on that at the time. So instead, I pivoted to a different profession, and education became my passion. It still is my passion, and we'll talk a little bit about that probably later. But I just got away from chiropractic for about 20 years. I was in education, and it came full circle, though. I realized that education was something I'm very passionate about. I enjoy very much. But when my mother got ill, I realized our healthcare system is a broken system. And I really felt like I wanted to contribute in some way that was not necessarily in the way she was being treated as a patient. She had cancer, and she would go and get her chemotherapy treatments, and then she would just go home and wait until her next treatment. And there was really no emphasis on how do we take care of you between these treatments? How can we make you feel better? So that I realized that maybe that's an area where I can make a difference. So at the age of 39 or 40, I believe, I decided I would go ahead and become that chiropractor that my father had encouraged me to become when I was a young person.
Oh, that's fabulous. You of course grew up in the household of someone who went to the first chiropractic college in the country, I believe. Is
That's
that
right.
accurate? Right.
That's right.
And found yourself coming all the way to University of Western States from the Midwest, which is the second oldest chiropractic
That's
college
right.
in the country. Fun fact for our listeners and viewers: the reality of our existence is predicated on the fact that Dr. Palmer, and a couple of other folks came out west, and we had I believe it was four competing institutions of chiropractic in Portland, Oregon, some 121 years ago. And then
Hmm.
University of Western States was born as the Marsh College and consolidated and all that good stuff. So
That's right.
you're living in the history and you're bringing it forward, Dr. Kaeser. It's pretty awesome. Could you help our audience understand a little bit exactly what chiropractic is? I think we'll get into the misconceptions and biases in a little bit out there in the public domain, but I think when I came, I had I had engaged in chiropractic care, but I don't know that I was all that familiar with the kind of just exactly what it is a chiropractor does. And so
Hmm.
maybe for our audience, that would be
Hmm.
helpful to hear.
So a chiropractor is going to address the musculoskeletal system first and foremost of a patient, right? So a patient likely going to come into an office and have some kind of pain, and the chiropractor is going to take a thorough history, a thorough assessment, and determine how to manage this, and determine that whether they can or can't manage it, right? There may be some instances where a chiropractor will need to co-treat or will need to send the patient out to get care, but because the chiropractor really is going to focus on the musculoskeletal system and the nervous system when it comes to treating a patient. And it's often with hands-on approach. So if a patient is struggling with some kind of low back pain, headache, those kind of things, there's going to be some form of manipulation that takes place after a thorough history, after a thorough assessment. And so that's going to be this conservative hands-on approach to getting a patient better, right? Their first line is not going to be their first way to treat a patient is not going to be necessarily with medications, and actually that's out of our scope of practice. We're not going to ever treat a patient with medications. That would be something though that we would send a patient out and co-treat with a medical doctor if that were needed, but we're a very hands-on profession, and addresses mostly musculoskeletal and neurological
That's great.
concerns.
That's great. It is, a friend of mine, when I was deciding whether to come to University of Western States, they're like, well, I don't know about that chiropractic profession. And I said, well, my time here has proven otherwise, that it's a rigorous, scientifically based or evidence informed based approach to healthcare. There are a lot of distinctive factors about UWS in terms of how we work with conventional medicine, which is just, those were some real anchor points for me coming into the institution. And I know for many of our students and faculty, it's a game changer. That said, there are a lot of misnomers and mythologies out there about what chiropractors do or don't do. Um, would you be willing to address just a few of those for our audience today and talk about maybe how chiropractors in general combat those mythologies and things that we could do collectively in education and the chiropractic profession can do to further legitimize the very fine work that they do?
Mhm. Oftentimes we hear, especially if we're in the midst of other healthcare practitioners, we hear sometimes that, well, you're not a real doctor, right? You're not an MD, so you can't be a real doctor. And of course, the way we would answer that is we have a very rigorous educational program that's very similar to a medical doctor. We do graduate with a Doctor of Chiropractic degree, which means that, yes, we are, in fact, doctors. And talking about some of that rigorous education we go through that's very similar to a medical doctor. The basic sciences are going to be comparable between the two professions, right? We are going through all the microbiology courses, the human anatomy courses, the histology, all of those ologies, if you will. We have that background. There, we're also going through a heavy clinical education courses. So we're learning how to diagnose and manage a patient. We're going through the chiropractic science courses where you're learning to treat the patient with safe manipulation and determining whether that is best for the patient, whether manipulation is best for the patient. So yes, we are doctors, we are licensed practitioners, just as medical doctor has boards. Medical students have boards they need to take. Our students need to take boards, whether they're international students or they're national students. They're needing to take multiple parts of their boards in order to be a licensed DC and a licensed doctor. So that when I hear that you're not a real chiropractor, that's how I combat some of those things. Also, I hear oftentimes once you go to a chiropractor, you're never going to stop going to a chiropractor. They're always going to want you to come back. Well, my first comment is it's your choice. You are the patient and you have a choice whether you would continue care with the chiropractor or not, right? Um, I also mentioned that the musculoskeletal issues, if you will, the condition that you may have, the aches and pains you may have, that probably arrived over multiple years, months of, and it's not going to be something that we can just take care of in one visit. So yes, we are going to, in order to get you back to functioning in the way that you want to be functioning and meeting those goals that you have for yourself, it is going to take a few more, it is going to take multiple visits. And it's all determined by the assessment, the history taking. It's going to be all based on who you are and how you're going to um, how you're going to end up um, benefiting from the care,
Yeah.
right? So it's very individualized, I guess, is what I'm trying to say. Right. So
Which
some
is
folks may have to come multiple times, others maybe not as many.
which is truly a remarkable asset, I think, to the chiropractic profession. Yeah, many of our students, student interns, and practicing faculty, as well as the practitioners I've met out in the field, often take quite a bit of time with the patient
Absolutely.
on the front end. And of course, there's the kind of crude term whack 'em and crack 'em
Mm-hmm.
physicians, not to put any bad things out there about that approach, but certainly the way we teach our students is to really take a patient-centered,
Absolutely.
really wellness approach to helping that individual achieve their goals and objectives. Is that fair to say?
No, that's absolutely fair to say. Yes.
Okay, great.
Yeah.
One of UWS's, I think, shining stars, if you will, is this idea of evidence-informed, evidence-based care, evidence-based, evidence-informed curriculum. Could you briefly describe what that is exactly and what sets UWS apart from maybe some other types of programs? We won't
Yeah.
list the names of the schools,
Absolutely.
but certainly, yeah.
Absolutely. So we take pride in our evidence informed approach, and students come to us because of that evidence informed approach. I hear that most often when I ask a student why they are interested in UWS, and they often are saying because there is such an evidence informed approach to what we're doing, whether it's evidence informed approach to how we're educating students. We're using the best practices when it comes to adult learning theory and how students learn. We're also using the best practices and that evidence when it comes to teaching teaching our students how to treat a patient. So not every, it wouldn't be realistic for us to have our students going to their literature every time a patient comes in and they want to um, treat that patient in an evidence-informed manner. It's just not realistic. We don't have enough time in the day to do that. But we're going to teach um, our students how to access that literature, how to use that as the starting point for the decisions we make. But at the same time, as I said, in clinic, we can't always go to the literature and and make decisions for every patient. There's the clinical, there is the clinician expertise that goes along with this evidence-informed approach, right? And all the DCs that have been in practice for multiple years are going to tell you, I'm I have seen this type of patient, I have seen this presentation of multiple times, and I know how I'm going to treat them because of my expertise in that area, right? And so an evidence-informed approach does focus on the literature and what is in the literature as far as the research goes to treating patients, but it's also using and it's respecting that clinical expertise that our clinicians have. And then we also are wanting our patients to have a say in the treatment as well, right? We can't ignore the patient in a very patient-centered profession like ours. We
Right.
also want to involve them in the decision making. So everything we in our curriculum, we have that thread of evidence informed um, application, if you will, to many things that we're teaching students so that they know how to apply that evidence when it comes to making decisions about their patients because it's going to impact the patient outcomes in a positive way.
Oh, big time. Yeah, absolutely. You've already alluded to this in many ways, but I would guess a lot of our audience and listeners who are tuning in, if you will, to use an old radio term, are thinking about chiropractic as a career. But we'll probably have some folks who are thinking about, like, if I had choices, I might look at becoming an MD or a DO or a DC or a doctor of physical therapy. There's a whole panoply of options out there. Why should a student or a prospective student consider chiropractic as a career, and specifically University of Western States?
Yeah, so I spent some time thinking about this question because here I've had this posed to me before. Why should a student choose X over Y? And I'm never going to downplay any healthcare profession. I think
Yeah.
that every all professions are beneficial, but I think the way I'd like to answer that is I travel around as I talk to travel around or doctors come into onto our campus and talk to me. It's just that passion that they exude for the profession and have for their entire life, right? I saw this with my father. I see this with DC's alumni, with our community based clinical educators. I see it with our clinical educators here on campus. They're continuing to practice with passion. How could any student not look at that and say, I want to do that. I want to have that passion as I go through my career 30 years, 40 years, that kind of passion. And I think that passion draws from they get the connections with patients, that hands on connection with patient, that face to face connection. And there's nothing better than being told by a patient, you've changed my life. You have helped me to do this. I'm able to now interact in a way I've never been able to. I never thought that I could run a mile as a 65-year-old, and now I'm running a mile and I'm competing with some of these younger folks. It's just that how could that not charge up a physician, chiropractic physician? So and that's why I think the choice is right to be a chiropractor, right? It is. You also can oftentimes write your own business plan, if you will. There's so many opportunities for chiropractors, right? There's solo practices, there's multidisciplinary practices, there's hospital based clinics, there are community health centers. You can stay in radiology, you can do what I'm doing and stay in academia. Um, you can you can do both. Many of our faculty are not only teaching here at the university, but they're also practicing. So you can just write your own um, journey, right? You just really, you're not stuck in one area your entire life. You might decide that you want to start pursuing sports medicine and you go that route. So I think it's just exciting. And I have heard it brought down to just a few. One final thought I'll mention on this. So oftentimes our students will say, I either was going to be a physical therapist or I was going to be a DC. And I've heard it summed up as a physical therapist, you are able to treat the patient, right? But as a chiropractor, you can assess, diagnose, and treat. So the diagnosis part may not be as strong as the diagnosis part that the chiropractic profession has. And that often is something students really resonate with. They want to be able to see the patient throughout the entire span of their health care. So I think that's what a chiropractor can do as a provider, a portal of entry provider, right?
Which is incredible. Yeah. And to your point, there are so many pathways for students to choose once they graduate from the program. Now, very briefly, but it's an important question. So, what is the typical length of our chiropractic curriculum? And when they graduate, how do we determine they're competent?
So not only are you going to learn, we're going to have you learning clinical education skills early on, you're also going to be immersed in your first year in the foundational sciences. The foundational sciences are important because you're going to need those in order to pass your licensure exams. It's also important so that you can make some connections to these foundational skills and patient care later on, and patient diagnosis, if you will. Throughout the program, you're also going to start learning how to treat the patient, how to adjust the patient, how to some of the soft tissue techniques that you're going to learn so that you're able to manage the patient. And I talked a little bit about the evidence informed approach that we take. Those are also woven throughout the curriculum. You also have some opportunities to choose electives. So we talked about there's many pathways you can take after graduation. There's also some pathways you can take in the curriculum, whether you want to explore further some managing pediatric patients, maybe you want to explore some specific techniques, you're able to do that then in the electives. So how do we determine you're competent by the end of this program? You're going to need to demonstrate competency as part of the accreditors. The accreditors let us know that the students need to have X, Y, and Z. I think there's 32 X, Y, and Zs in order to graduate from our program. And so you need to reach a certain threshold, and then we have to determine that you are competent to go ahead and sit for those licensure exams then, and to graduate with a Doctor of Chiropractic degree.
That was absolutely phenomenal. If I ever had the skill to articulate a 3-year curriculum in that kind of a time frame, I'd have been like a millionaire. That was really, really terrific.
Thank you.
So, last couple of questions I have for you. These are fun, a little easy, but
Excellent.
I think impactful. So, in a few words, when you think about University of Western States, what comes to mind?
I think community. I think we are a community of students and a community of students with faculty that are also involved in developing that community. And all of that community is for the good of the patient, right? We're really working to make sure our students not only take care of each other, but also with the end in sight, taking care of our patients.
That's great. And lastly, what does whole person health mean to you?
Yeah, whole person healthcare is something that we are teaching our students to be able to address when they graduate. Not only seeing the patient as someone who's coming in with pain, whether it's headache, low back pain, maybe an extremity, they have elbow pain, whatever. They're coming into us with one complaint, but we're going to look at the whole person. We're going to look at the things that may have impacted that patient's headache, their low back pain, or their elbow pain. So it's really exploring the patient, whether that's through the history taking, whether that's through the assessment or the orthopedic test, but really looking at the whole person. Sometimes that can be looking at their diet. That can be looking at what is a what's a typical day look like for you, so that we can start figuring out how why that neck pain, back pain, or elbow pain may have started in the first place.
That's right. That's very good. And I think, just a quick sort of musing about this is that we were having a conversation some time ago up in Vancouver, British Columbia, with a practitioner, and we were talking about the importance of counseling and psychology in relation to the profession. And they were so excited that we were offering those disciplines and wanted to know if they could enroll in one of those courses to augment what they are doing in the clinic to, within scope. Clearly,
Right.
there are limitations,
Right.
but also to be able to identify some of those key
Absolutely.
challenges. And I would say to all the other areas that you were talking about, I think of all the stressors and the mental health challenges that are rampant across our country and really around the globe. And those can impact your neck and spinal health as much as anything else, I would think. So,
Absolutely.
yeah, yeah, that's
Absolutely.
great.
Yep.
Well, Dr. Kaeser, this has been a joy. I really appreciate you taking time out of your busy day, and we know you're really busy. Where can people find you online? And if you have any books or research you want to point people towards, that would be great too.
Yeah, you can reach me at LinkedIn. I'm there. And other than that, I don't have a lot of other social media um, contacts, but LinkedIn, you could definitely find me there. I do have some publications. You can go to PubMed. I think there's a good dozen of them or so. I have been published in some peer-reviewed journals like the Journal of Chiropractic Education or Humanities, Clinics and Practice. So before I was a before I so I came out of chiropractic school and I immediately went into a radiology residency program. So I really got involved with residency heavily. And at that time, I had to do a lot of publications. So you'll find some of my publications that I did when I was in my residency program.
That's beautiful. A published author to boot. That's terrific. So let that be an opportunity to note for our current students. Talk to Dr. Kaeser about our research. I have no
That's right.
doubt it's probably really good. So many thanks, Dr. Kaeser.
Absolutely. Thank you.
And to our audience, thank you for spending time with us today. I encourage you to keep exploring the vast world of health and wellness and all that it offers, because it does lead to richer, healthier, and happier lives. As a reminder, you can find us online at www.uws.edu. And you can also visit us on social media. You can find me on LinkedIn, Facebook, X, or formerly known as Twitter, and even Instagram. I hope you'll continue to join me. This is our very first inaugural podcast. We'll continue to evolve it, but Dr. Kaeser was willing to join us on this maiden voyage, which I am truly, truly grateful for. And I hope you'll join our guests and me as we continue to explore the mind, body, and beyond. Take care and be well. Signing off for now.